My name is John DiDonato,
And I'm Kathleen.
and we had a little baby named John.
Our son was born with bilateral microtia and atresia. Cut.
So yeah, Kathleen's pregnancy was fine. She was healthy. Everything worked out. She delivered on the right day, roughly.
I had a natural birth. Everything was good, and then after he was born, the nurses placed it on my stomach and just said like something was wrong with his ear, and we thought it was just one ear.
You could see it right away that he had one small ear and then one kind of normal looking ear, and so we knew something was wrong right away, but we didn't know what, and actually no one would tell us what for a while. I don't know, it wasn't until we had the 3 days in the hospital
Where you were on your phone Googling stuff.
and I started to have an idea of what it was.
Nobody would give us a diagnosis of microtia or atresia, and atresia means you don't have ear canals, and microtia means your ears don't fully form. So they're two separate things. So he doesn't have any ear canals in either ear. It's just kind of blocked. It's just skin covering it. And on top of that, his ears don't form fully in the uterus. So we got a poor diagnosis. We didn't really know what he had, and finally we were referred to somebody at UNC who was amazing and really gave us hope that everything was going to be okay. I was kind of thinking after he was born the worst case scenario, because we just didn't know, and nobody was kind of saying anything that first couple days in the hospital, and everything will be okay, and everything does work out, and just the best advice we got was to enjoy your newborn baby. And
He has a deformity in his ears, so we're not sure what path we would want to go, if there's some sort of reconstruction surgery that would take place, or do we just let it go, or whatever he wants to do.
Yeah.
So there's a lot of stuff in the future that is concerning, just how kids will behave and pick on them, and that type of stuff it's still concerning, but as far as his hearing, I'm very pleased with it.
Yeah, he wears a Baha, which is a bone anchored hearing.
Bone anchored hearing aid.
Yeah, hearing aid. So and a bone conduction hearing aid works through his bones, since he doesn't have ear canals and can't hear through his air passages. So a lot of times people think he's wearing a camera on his head, a light on his head. They think he's wearing a sweatband. They think a lot of things. They don't think it's a hearing aid, which is totally understandable, because I didn't even know a hearing aid like that existed until we had him. And in the past 2 years, or less than 2 years, we found out a lot of information and have now kind of become experts ourselves, because even our audiologist at UNC had to do a little bit more research, because although they do see people there wearing this type of hearing aid, it's not as common as a traditional hearing aid or a cochlear implant. So he's been outfitted with his hearing aid since he was about 3 or 4 months old, and he's been wearing it ever since, and he's doing amazing. And there's only 3 out there.
It seemed like 3 or 4 bone conduction hearing aids that were available. We struggled with it a little bit.
I mean, I'm a teacher, so I did have some experience with hearing aids, but I mean, we've never had to deal with a hearing aid, so we didn't know, is it working properly? Is it not working properly? Should it be making this sound? Should it not be making this sound? And it's hard, because when you put a hearing aid on an infant, I mean, they don't have a neck or anything. They're little, so it was touching everything, and it was making all this beeping noise. And well, a baby can't tell you, hey, this isn't working right. So we didn't end up finding out till we went back to the audiologist at UNC. So, I mean, equipment and hearing aids and all the things that go along with them can be very frustrating. And I think that until he's old enough, which might not be for many more years, to tell us, hey, this isn't working right, or this doesn't sound right, it's just, you have to stay on top of it. And
as far as this area in North Carolina, on Chapel Hill UNC that I'm glad that we're here because we originally came from Massachusetts, but I feel like the audiology department in UNC, doctors in UNC, everything's been great. We're happy with that.
It just
It seems like the community around here for hearing loss has been great, especially with this care project,
There's
beginnings,
groups.
hitch up, castle, all that type of stuff.
I think
all the people that come to the house, the early
early
intervention,
intervention through the
everything's
state.
been pretty good, very helpful. We have a very somewhat rare, very rare, where we've never seen anyone else with it. I never knew it existed. We never see anyone else with it, especially in groups like this.
Everyone's just different. So
Yeah.
everyone's child is different, and you just kind of have to, even kids who have similar things, it seems like every kid is different and develops differently. And I mean, your kid is your kid. So you're going to love them no matter what.